The health disparities here in the black community, both in Pennsylvania and nationally, are numerous, and it's tragic that they exist in 2022. It just shouldn't be that way. And as a former four-term mayor of a majority black community, I saw firsthand what happens in a community that is ultimately denied access to health care. When I was mayor, UPMC decided they were going to close our hospital, and that shut thousands of people off from proximate access to health care that was once a community anchor. And during that fight, we were able to achieve a measure of healthcare access for our black community. We opened an urgent care center, but it is not anywhere close to the healthcare and the access that was lost during that. Here you had a giant nonprofit with billions in revenue turning its back on a community that the health disparities are already far, far too great. And if I'm the next United States Senator, those are the kind of issues that I'm going to be bringing my expertise and perspective on to Washington, D.C. During the pandemic, I'm proud to say that Governor Wolf asked me to chair the COVID-19 Response Task Force in racial disparities. And we studied all across Pennsylvania just how much more impactful and destructive the COVID-19 pandemic hit black communities all across Pennsylvania, in large part because many of these communities, workers were on the front line, and they were forced to work through because they were the essential workers that helped us as a state weather the pandemic. And we need to respond and make sure that we owe them to closing this health disparities gap here in Pennsylvania. Another disparity that has long been troubling is the black maternal death rate, not only in Pennsylvania but nationally. It is a sin that it has gone unchecked, and that the gap still is so large. And that's one of those issues that if I'm your next United States Senator, I would really want to take up that cause. This is a critical issue that we have to address both here in Pennsylvania and nationally. And my wife has taken that cause up during her time as Second Lady. And that, to me, from my perspective, is an issue that I would very much like to champion as your next United States Senator, because we have to start at birth and we have to close that gap. And fundamental fairness in healthcare begins at birth. And right now, both in Pennsylvania and nationally, we are failing in that. Thank you.